Caring for a newborn during the first 30 days is a journey filled with wonder, learning, and a deep sense of responsibility. These first few weeks are crucial as your baby adjusts to life outside the womb. Every little action, from feeding and sleeping to bathing and soothing, can feel daunting at first. However, with understanding and care, you'll gain confidence and establish a nurturing routine that supports your baby's physical and emotional development. The first step in caring for your newborn is understanding their basic needs. Newborns rely entirely on their caregivers. They need to be fed frequently, kept warm, cleaned regularly, and comforted when they are distressed. This period is not only about tending to their immediate needs, but also about building the foundation for a strong parent-child bond. One of the most important aspects of newborn care is feeding. Whether you choose to breastfeed or bottle feed, feeding should occur on demand, typically every 2 to 3 hours. In the early days, your baby's stomach is very small, so they require frequent, small feedings. Breast milk provides the ideal nutrition, rich in antibodies that help protect your baby against infections. If breastfeeding, ensure that your baby latches on properly to prevent nipple pain and promote effective milk transfer. If you opt for formula feeding, choose a formula designed for newborns and always follow the preparation instructions meticulously to ensure your baby receives the right balance of nutrients. During feeding, it's essential to observe your baby for signs of hunger and satiety. Rooting, sucking on fingers, and fussiness are common hunger cues. When your baby turns away from the breast or bottle or falls asleep during feeding, it may signal fullness. After feeding, remember to burp your baby to help release any air swallowed during feeding, which can reduce discomfort and spitting up. Sleep is another critical component of newborn care. In the first month, babies sleep between 16 to 18 hours a day, but their sleep is spread out in short intervals. They wake frequently for feedings and diaper changes. It's best to let your newborn sleep when they need to, rather than trying to establish a strict schedule in these early weeks. To provide a safe sleep environment, always lay your baby on their back on a firm mattress without loose blankets, pillows, or stuffed animals in the crib. This reduces the risk of sudden infant death syndrome, also known as SIDS. The sleep patterns of a newborn can be unpredictable, and you may find yourself awake at odd hours. Try to rest when your baby sleeps, even if it means taking short naps during the day. This can help you cope with sleep deprivation and maintain your well-being. If you're sharing nighttime responsibilities with another caregiver, consider alternating shifts so each of you gets some uninterrupted rest. Diapering is a frequent task in the first month, as newborns typically need their diapers changed 8 to 12 times a day. Keeping your baby clean and dry is essential to prevent diaper rash. Use gentle, unscented wipes or a soft cloth with warm water and allow your baby's skin to air dry before putting on a fresh diaper. If you notice redness or irritation, apply a thin layer of diaper cream to protect the skin. Change diapers promptly after bowel movements to minimize irritation. Bathing your newborn is another important aspect of care, but it doesn't need to happen daily. In the first month, sponge baths are sufficient until the umbilical cord stump falls off and the area heals. Gently clean your baby's face, neck, and diaper area with a soft cloth and warm water. When it's time for a full bath, use mild, fragrance-free baby soap and ensure the water is comfortably warm, not hot. Support your baby's head and neck at all times and never leave them unattended during bath time. The umbilical cord stump requires special attention in the first few weeks. Keep the stump clean and dry and avoid covering it with the diaper. Fold the diaper down or use newborn diapers with a cutout for the cord. The stump usually dries up and falls off within 1 to 2 weeks. If you notice redness, swelling, foul odor, or discharge, consult your pediatrician as these may be signs of infection. Caring for your newborn's skin is equally important, as their skin is sensitive and prone to dryness and irritation. Avoid using harsh soaps or lotions. Dress your baby in soft, breathable fabrics, and wash new clothing before use to remove any potential irritants. Keep your baby's nails trimmed to prevent accidental scratching, and use mittens if needed. Bonding with your baby is a beautiful and essential part of the first month. Skin-to-skin contact, also known as kangaroo care, helps regulate your baby's body temperature, heart rate, and breathing, while also promoting emotional connection. Hold your baby close, talk to them, and make eye contact. These simple acts of love and attention foster a sense of security and trust. Soothing a fussy newborn can sometimes be challenging. Babies cry for various reasons. They may be hungry, tired, overstimulated, or in need of a diaper change. Sometimes they just need to be held and comforted. Try gentle rocking, swaddling, or softly singing to your baby. White noise, such as the sound of a fan or a lullaby, can also be calming. Learn your baby's unique cues and preferences. Over time, you'll become more adept at understanding their needs. Health and hygiene are paramount during the first month. Wash your hands thoroughly before handling your baby, especially after changing diapers or before feeding. Limit visitors to reduce exposure to germs, and ensure anyone who handles your baby is healthy and clean. Newborns are vulnerable to infections, and even minor illnesses can be serious for them. Monitor your baby for signs of illness, such as fever, lethargy, poor feeding, or unusual fussiness, and consult your pediatrician if you have concerns. Immunizations and regular checkups are an essential part of newborn care. Your baby will have their first health check within a few days of birth, and follow-up visits will monitor their growth, development, and overall health. These appointments are an opportunity to ask questions and seek guidance on any concerns you may have regarding feeding, sleep, or behavior. Newborns communicate primarily through crying, but they also express themselves through body language and facial expressions. Pay attention to their cues, such as rooting for food or arching their back when uncomfortable. Responding promptly to your baby's needs builds trust and helps them feel secure. As your baby grows, you'll notice small but meaningful changes each day. They may begin to focus on your face, respond to your voice, and show signs of early social smiles. Celebrate these milestones and take time to marvel at your baby's unique personality emerging. It's normal to feel overwhelmed or uncertain at times. Caring for a newborn is a significant adjustment, and it's important to seek support when you need it. Reach out to family, friends, or parenting groups for advice and encouragement. Remember, there is no one-size-fits-all approach to parenting. Trust your instincts and do what feels right for you and your baby. If you are breastfeeding, ensure you are also caring for yourself. Stay hydrated, eat nutritious meals, and rest as much as possible. Breastfeeding can be demanding, and your well-being is vital for both you and your baby. If you encounter challenges, such as latch issues or concerns about milk supply, seek help from a lactation consultant or healthcare provider. If you are bottle feeding, practice proper bottle hygiene. Sterilize bottles and nipples before each use, and discard any leftover milk after a feeding. Hold your baby semi-upright during feedings to reduce the risk of ear infections and help with digestion. Tummy time is recommended from the early weeks, as it helps your baby develop neck and shoulder muscles and prevents flat spots on the back of the head. Start with a few minutes of tummy time each day when your baby is awake and alert, gradually increasing the duration as your baby gets stronger. Always supervise tummy time and ensure your baby is on a safe surface. Clothing your newborn appropriately is important for their comfort and safety. Dress your baby in one more layer than you would wear to feel comfortable. Avoid overdressing, as overheating can be dangerous for infants. In cooler weather, use a hat to keep your baby warm, but remove it indoors to prevent overheating. Monitor your baby's temperature and watch for signs of overheating, such as sweating, flushed cheeks, or rapid breathing. If your baby feels hot to the touch or seems uncomfortable, remove a layer of clothing and check their temperature. Keeping your baby's environment clean and safe is equally important. Regularly clean and disinfect surfaces, especially those that your baby comes into contact with, such as changing tables, cribs, and toys. Ensure that your baby's sleeping area is free from hazards, and avoid using bumper pads, heavy blankets, or any items that could pose a suffocation risk. When it comes to outings, limit your baby's exposure to crowded places during the first month, as their immune system is still developing. If you need to go out, dress your baby appropriately for the weather and keep them protected from direct sunlight. Always use a properly installed rear-facing car seat when traveling by car. New parents often worry about their baby's weight gain and growth. It's normal for newborns to lose a small amount of weight in the first few days after birth, but they should regain it within the first 2 weeks. Regular checkups with your pediatrician will help monitor your baby's growth and ensure they are thriving. Caring for your own mental health is just as important as caring for your baby. The first month can bring a mix of emotions, from joy and excitement to anxiety and exhaustion. Postpartum blues are common, affecting many new parents in the days after birth. If you find yourself feeling sad, irritable, or overwhelmed for more than 2 weeks, or if you have difficulty bonding with your baby, reach out to your healthcare provider for support. Postpartum depression is treatable, and you are not alone. Building a support network can make a significant difference. Don't hesitate to ask for help with household chores, meals, or caring for your baby so you can rest and recover. Accept offers of assistance from family and friends, and communicate openly about your needs. Trust is the cornerstone of your relationship with your newborn. By responding to their cries, holding them close, and providing consistent care, you help your baby feel safe and loved. This sense of security lays the foundation for healthy emotional and social development in the months and years to come. As you navigate the first 30 days, remember that every baby is unique. Some may feed more frequently, others may sleep longer stretches, and some may be more sensitive to stimulation. Be patient with yourself and your baby as you learn together. The routines you establish now will evolve as your baby grows, and flexibility is key. Documenting your baby's early days through photos, notes, or a journal can be a meaningful way to capture these fleeting moments. Looking back, you'll be amazed at how quickly your baby changes and how much you've learned. In summary, caring for a newborn during the first month involves attentive feeding, safe sleep practices, gentle hygiene, and lots of love and patience. It's a time of profound transformation, both for your baby and for you as a parent. Embrace each day with curiosity and compassion, knowing that your care provides the foundation for your baby's health and happiness. The journey may have its challenges, but the rewards, those first smiles, the feeling of your baby's hand in yours, the quiet moments of connection are truly priceless. As you move forward beyond the first month, you'll gain confidence, deepen your bond with your baby, and discover the joys and surprises that parenthood brings. Remember, you're not alone on this journey. With knowledge, support, and love, you and your baby will thrive together.